Namaskar, I am Dr. Jamal Khan. I am trying to connect with our English speaking Indians who are located mostly in South India. They don't follow Hindi. I thought I should be able to connect with them as well. So, I am practicing cancer immunotherapy for last 22 years now. And cancer immunotherapy is basically a treatment protocol which takes into consideration a specific treatment or a tailor-made treatment which is defined in two formats. One is passive immunotherapy and the other is active immunotherapy. I am a specialist in active immunotherapy where we take patient's own white blood cells from his blood sample, culture them in the laboratory, make them dendritic cells which are master cells of immune system, and these dendritic cells direct the T cells in the body to transform themselves into T helper and killer cells. So they generate the specific anti-cancer immunology inside the body which will help in resisting the cancer spread and lowering the disease which is already there in the body. So it is devoid of any toxicity. It has no toxicity like we see in chemotherapy, but it is not an alternative to chemotherapy or radiation. It is in addition to what we are doing in conventional oncology. So my purpose of treating patients with cancer immunotherapy, active immunotherapy is not to replace chemotherapy, but to have an additional role where we determine that the patient should remain disease-free for a longer period of time with no relapses. And the passive immunotherapy, which I was just telling about, is taking medicines which are specific to particular cancer antigen, which has to be present inside the cancer based on the immunocytochemistry of the cancer. When we do the biopsy of the cancer, we also check for immunocytochemistry, immunohistochemistry we say, that these particular antigens are present in the cancer tumor and they should be addressed by the specific anti-cancer immunotherapy. That is passive immunotherapy. It can be given in the form of tablets, oral medication, or it can also be given in the form of injections. But the only issue is it is also very effective. But the only issue is it has time limits. It will not be effective for life. It has to be given continuously without failure till the disease progresses, and then we need to stop that particular immunotherapy. Unlike active immunotherapy, which will transform the entire cell population once it is being administered, say for one course of treatment that is comprising of 6 doses, or maybe 2 courses of treatment that is comprising of 12 doses, or even 18 doses, depending upon the staging of the cancer, depending upon the amount of cancer one has in his body. Like we see in stage 4 cancers, cancer spreads to various other organs also. That's how we define stage 4 cancer. When the cancer is at a particular place, for example, I give you an example of a breast cancer, where the cancer is localized inside the breast only. We call it stage 1 or stage 2, depending upon the size of the tumor, depending upon the hardness of the tumor, and depending upon the adjoining structures which is covering. But supposedly the cancer touches the muscle of the chest wall, it becomes stage 4 cancer because now it has spread to the other organ, which is the pectoralis muscle of the chest wall. Or it goes inside the deeper structures and may go to the lung, or it may go into the axillary lymph nodes where it is stage 3 cancer. The axillary lymph nodes are situated in the axilla. So when we talk of advanced stage cancer, it can even go to the liver, it can go to the bones also. It sometimes spreads to the brain. So the amount of cancer is directly proportional to the amount of immunotherapy one has to take for a particular period of time. So if we say 3 courses of treatment, and in these 3 courses of treatment, we do PET-CT scans, and if we see 2 PET-CT scans consecutive free of disease in 3 months period, then we can stop the treatment for active immunotherapy. So we have patients of advanced stage disease who started these treatment. Those patients started the treatment along with chemotherapy or because they were failing with chemotherapy, and we did this treatment and we got good results in say 30% patients of stage 4 cancer, and out of 10 we have 3 patients who are free of disease also. So for these people, our population of Indians who don't follow Hindi, I thought I should be speaking in English and trying to explain to you that this therapy was considered good because the pioneer of this therapy, Dr. Steinman, got the Nobel Prize also for the discovery of dendritic cells based on the importance of this therapy, which has been discovered after successful treatment for prostate cancer. In prostate cancer, US FDA has approved dendritic cell therapy for advanced stage patients, but the inclusion criteria at that stage was they have already exhausted all resources of treatment. And in these patients, the expected life span was even some weeks. So it has reached to 3 months to 6 months, which was considered very less as compared to conventional treatment plans. But this therapy got an approval at that stage. But the cost of the therapy was quite inhibitory for many of the people who were living in US. It was around say 95,000 US dollars at that time for 3 doses. So many patients were not able to take this treatment. Many insurance companies were also not giving this treatment for their patients. So that's how once this discovery was made, once this treatment came into existence by US FDA, the pioneer of this therapy got the Nobel Prize. So I started this therapy around 22 years. I am also a disciple of Steinman. I worked with his team for some days, for some months in various locations around the world. I was in US also for some months. So me and Sharmeen Yaqeen, both of us doctors, we described this protocol India, we discussed, we described, we executed this protocol India for the first time. We published our results long back 20 years ago in scientific journals, and that's how this therapy came into existence. I have treated around 20,000 patients till date, consulted more than 50,000 patients. We have our clinics located in Mumbai, Ahmedabad, Hyderabad, Lucknow, and we have a satellite clinic in Bangalore also. So that's how we are doing this therapy in India, and I wish you all very good life, healthy life with no cancer. But if supposedly some of you are having this disease, you can contact me on these addresses I have been mentioning here in this slide, along with the phone numbers, along with the mobile numbers we have, as well as our emails. And we will come back to you with some concrete plans for you, and our team of doctors can discuss at length how we can help you in your disease. Thank you so much. Jai Hind.